what we do in my clinic is the same for every single patient journey. Okay, we start with a thorough ear examination. So we'll look at the whole outer ear, understanding every part of it. If there's wax, we'll identify it, explain how it works and how we can prevent it. What we do then, we use a nice high spec video camera, and we understand exactly the internal parts of the ear and if there's any damage. That highlights a lot more information for us. And then we'll test the middle ear. So we'll actually test the gap between the outer and the inner ear and see if that's performing nicely. It's like a drum. If it's nice and healthy, you bang it, lots of volume. Potentially that could be one of the causes. We then go through and we spend a lot of time understanding you and your speech understanding, because it's really crucial that you get the next part. In all consultations, you'll hear me focusing on the brain. We hear with our ears, we listen with our brain. We go outside, every sound we hear is completely involuntary. We're always hearing things. In order for us to actually listen to those things, we have to engage the brain, because a bus sound, we were taught. We don't just wake up and know what the sounds are. So in order for us to learn those sounds, we have to be using the brain. And that interaction between the ears and the brain is what we test more thoroughly in my clinic. We do the beep test. Everybody has to have the beep test because that gives us your prescription. But that tells me one piece of the puzzle. It doesn't tell me much about you and your lifestyle. So we'll do some extensive speech testing to understand how you hear versus a normal person in normal environments. So we can say maybe you're hearing 80% in that environment. Where would you like to hit 100%? Bigger focus is speech and noise, because that's the biggest complaint. In Northern Ireland, we're actually in conversation 65% of the time, and that's 10% higher than the national average. And that's why I live here, and that's why I love it here, is that people are always communicating. It's the best for crack. But unfortunately, that's terrible for hearing loss. So you can imagine, does everybody take turns talking, or does everybody talk at the same time? And really, really fast, like me. And once we understand how that all impacts during the tests and during the assessment, we understand uniquely what environments you struggle with. We test it with male voices, female voices. We'll understand how you hear in those environments, which helps us decide what type of technology to suit you and your lifestyle. We'll spend a lot of time then going through the types of hearing loss, because in simple terms, you could just have wax. And we hope for that, because a lot of my patients come through the door, they've been struggling for years and years, and it could have just been deep impacted wax. And we remove the wax. It's a dry procedure. We use microsuction. We're ENT trained in my clinics, and massive relief, and all of a sudden your hearing's back. And then it doesn't cost you anything. You don't need hearing aids. We've answered all your questions all in the first few minutes. It could be more extensive. It could be internal ear damage, and that's very common, but it's very easily treated nowadays. It's age-induced noise. So if you're exposed to loud noises, if you've worked in the military or the police, or you've been working in industry, you could have been exposed to loud noises. Your recreational activities, shooting, or obviously a lot of us going to concerts when we're younger. All these things could have damaged the ears slightly. And if we know how it was damaged, where it was damaged, and we'll pick this all up on our extensive questionnaire, we can better understand where your hearing loss came from and where it's going and how we can correct it to make sure that it doesn't impact you further in life. And the main thing we need to focus on in my clinic is the auditory process. If we understand that we hear with our ears, but we listen with our brain, and we understand the impact of long-term untreated hearing loss, it does lead to further complications, memory loss and things like that. But if we pick it up early and we do something about it, people don't think twice about going to your optician every 2 years, going to your dentist every year. But how often people go to their hearing care specialist and get their ears checked? And that's all we're saying. Come on, let's get it looked at.